Hello, hello everyone. Welcome to the Doctor Janine Show. I'm so happy to have you all here with me today. Please shout out and say hello. Please let me know where everybody is from. Thank you for tuning in. Thank you for all my new followers that have happened over the last week. And thank you for sharing today's live as well. It's so great to have you all here. Please say hello, shout it out. And if you're here for the first time, please put a 1 in the comments. I love to see all the new people that tune in every week. Okay, this show is jam-packed today. We are talking about healthy pee. I've had a lot of questions and I did a few posts about this. What our pee should look like. So healthy pee, we're going to be talking about the different types of healthy pee, as well as kidney detox. So what you can do to actually help your kidneys. We're also talking PCOS tips. Yes, ladies, I'm answering those questions because I get so many of them throughout the week with all of my posts, as well as going into the kitchen and sharing a delicious salad recipe. It's my go-to. It's so super simple. You're going to love this hack for making your salads. You're going to love it. And we're talking low thyroid. So going through some of the symptoms of having that low thyroid and more importantly, what we can do to fix that low thyroid. Okay, so hello, hello. Hello, Dora Mazafera. Nice to see you for the first time. Hello, hello. And Gusubel, nice to see you. I know there's some, Bill Hasso, nice to see you from Michigan. Hello, thank you for tuning in. Carly, hello, nice to see you for the first time. Thank you for tuning in. It's so great to have you all here. Thanks for sharing today's live as well. I am Dr. Janine, naturopathic doctor. We talk all things natural here. This is a show that you will absolutely love. We do this every Tuesday at this time, so please make sure that you tune in next week as well. We have quiz questions coming up. It's very fun, interactive. You can win a prize. You are going to love it. Okay, let's talk now about, what are we talking about first? Oh, if you missed last week, actually, if you did miss last week, so it does live on certain social media platforms that you can revisit all of the shows. So if you miss parts or if you tune in late, then this is something that you can look back at what I've discussed. So last week we talked about leptin versus lectin and what that difference is. We talked about oat milk versus almond milk, and I shared a little bit about my favorite. I did a beauty hack, as I like to do in most shows, and we talked about instant headache relief as well. And of course, the best foods to give you tons of energy. So that was last week's show. And of course, this week we've got a bunch of new topics, that some of which I don't think I've talked about ever before. So this is going to be fun. And I'm going to show you my famous salad hack. Hello, nice to see you. Jerry, nice to see you. Thank you for tuning in. It's great to see you. Svedash from Vegas. Hello, hello. Good morning to you. Nice to see you all here. Okay. And people from all over the world, from Turkey, from Pakistan, nice to see you. Thank you for tuning in. It's so great to have you all here. Okay, so let's now talk about the thyroid. So let's talk about symptoms of having a low thyroid, which is really, really common. And we will be coming back to what your pee should actually look like. So talking about healthy kidneys, healthy urination. But let's first talk about low thyroid. So hypothyroid, and this is a very common diagnosis I find a lot amongst women and having hormonal imbalances. Well, let's go through some of the most common symptoms. So lack of energy is probably the biggest one. So that lack of energy, even your memory can be impaired. Low mood as well can be a problem. And when we look at shaggy hair and hair loss, enlarged thyroid gland, slowed heart rate, and weakness, swollen face. So this entire region, we can see that we are losing all of that proper flow through the face, and that is problematic. So of course we want to make sure that we are having that proper function of the thyroid gland, and the thyroid gland is something that regulates our entire metabolism. So this is really, really important, okay? Weight gain, which is usually why people were gonna go to the doctor and say, hey, I've gained some weight, a little bit about thyroid and metabolism, and this often is what drives you to the doctor, and they do your thyroid test and they do your blood work, and yet that blood work either comes back that there's a little bit of an abnormality or that your thyroid is fine according to the blood work. Well, most times it's not fine and there could be an issue. And this is why I like to educate people about, if you've got a lot of these signs and symptoms of your thyroid being low, that you're doing something about it. And of course, we're going to share some tips about what to do. Okay, so that dreaded weight gain, as I said, slow bowels, constipation, that's a big thing with low thyroid. And of course, your metabolism is slowing down. dry, rough skin, of course, and this, you could also get muscle cramps. So your magnesium and your mineral status has a lot to do with your thyroid function as well. And of course, when we're talking about that slower metabolism and feeling cold all the time and cold extremities, you're very sensitive to the cold, or maybe one minute you're cold, the next minute you're like overheating a little bit. You could be getting those hot flashes. If you're getting night sweats, that can be a sign of that low thyroid as well. So these are all things that, we have to really make sure that we're on top of this. Definitely get your blood work checked for your thyroid. And I have different videos on my social media platforms that talks about some specific tests that you can ask for your thyroid panel. So that's something that you should definitely discuss with your practitioner. Okay, now, how do we know that it's a thyroid thing? How do we know that it's not a leptin issue? So here's the thing, and this is something that I've been through myself with having low thyroid, was having leptin resistance was at the cornerstone of developing a thyroid problem. So what is leptin resistance? If you're tuning in for the first time, you've never heard about what this is, then welcome, because this is something that's so important. That's why I share so many times and I go through what leptin resistance is all about, because that leptin signaling in the brain, of course, leptin is given off by our fat cells, and it tells the brain our state of affairs. Do we have enough body fat? Do we need to seek out more food? When you've got that leptin resistance, this then usually leads to that insulin resistance. But what happens is that with that leptin resistance, our brain isn't getting the proper signaling, and so now we are craving more and more food, and so usually all the wrong foods. It's always the carbohydrates, the sweets, and all the stuff that I used to eat a lot of and loved. But because of that, now you're gaining more weight, and it goes around and around and around. So this is a big problem with that leptin resistance, but this affects your thyroid as well. And so a lot of the symptoms of having leptin resistance has a lot to do with having low thyroid as well. And that's why my first tip, of course, if you've got low thyroid, diagnosed or not diagnosed, is to fix your leptin resistance, okay? So that's really important. Now, the other thing that I talk about is supporting your thyroid with the things that it needs. So thyroid support, and how do we support that thyroid? Well, we want to do it with specific nutrients and, of course, things that we can, of course, help to support that thyroid gland with. So let's go through them really quickly. What's the first thing that we are needing again is for the thyroid? Of course, iodine. And I dropped my thyroid. Where did I drop my thyroid somewhere? If somebody can, oh, there it is. Thank you. So again, the thyroid. So we need, of course, to support the thyroid with iodine. So iodine is something that's really important for proper thyroid function. As well as, let's go back over here, what's another mineral? I want to hear from you guys. What's another mineral that's good for the thyroid? Yes, of course, magnesium. So magnesium is the next one that we need. Of course, and getting adequate magnesium is super important for your thyroid gland. Okay, number 3, potassium. So potassium, again, is an important mineral needed by that thyroid gland. And number 4, how else do we support the thyroid? Calcium, another important mineral for the thyroid, as well as boron, another mineral that we need for our proper thyroid function, and forskolin. So forskolin is important, and this is a herbal medicine that supports the conversion of our thyroid hormones to the active. So the T4 has to convert to that active T3. So that's important for, of course, thyroid function. That is a herbal medicine that I take every day. I take 2 capsules of a thyroid support at bedtime every day to really help my thyroid gland. Okay. And number 7, tyrosine. That's a specific amino acid, of course, that we need for our thyroid hormone, to make thyroid hormone. So thyroid, of course, tyrosine plus iodine is what makes our active thyroid hormone. And ashwagandha. So ashwagandha is a fantastic herbal medicine, and you may have heard about it for stress, for sleep, for anxiety, but it also helps the thyroid gland, and that's really important. That's one of the reasons why I love that ashwagandha. Helps to support that proper thyroid function, and of course is something that we need to, of course, really relieve that stress, those cortisol levels, which is so important, because when we're stressed out, our cortisol is high. That's going to cause something called pregnenolone steal, and I've got videos on that, so if you haven't heard about that before, check that out. That pregnenolone steal is going to be problematic, and you're going to have more and more inflammation, more leptin resistance, and more cortisol being produced. So this is really important. And hello, nice to see you. Hello, and zinc is there on the list as well. Pura Rancho, yes, good point, absolutely. Is it GFL? You're skinny, still have belly fat, and you don't even eat that much. Okay, so belly fat is something that is very much related to those cortisol levels and stress, and it can be related to that leptin resistance as well, and something called pregnenolone steal. So that's something that we definitely want to be aware of. And yes, mineral drops work well. Daniel, good point. Mineral drops can work very well for your thyroid support. Hello, please say hello. Tons of questions coming in. Nice to see you. Thank you for tuning in. If you're here for the first time, it's so great to have you here. We're right now talking about low thyroid. So if you're just tuning in, we're going to be going to the kitchen in just a second with a great salad recipe, my hack for making the most delicious salad that you can take with you on the go, which is amazing. So we're going to go over there in a second. We're also going to talk about the different P types and why it's important to have a healthy urinary tract, and of course for your kidneys as well, and supporting your kidneys, which is so important. Now, can I take a look at this? I'm going to take a look at my cheat sheet for just a second. And we have some quiz questions coming up as well, which is going to be amazing. So that's going to be fun. And let's talk a little bit about the best foods for kidney detox. Is that where we're going next? Okay, yes, all right. I need my little roadmap today. How's everybody doing? Thank you for tuning in. If you're here for the first time, please put a 1 in the comments and let me know where you're from. Shivani is from Trinidad. Hello, nice to see you. Sunny Trinidad. I hope the weather is beautiful, which I don't think it could be anything but beautiful in Trinidad, which is amazing. Okay, and I know that there's some questions coming in about products. I'll have my team behind the scenes answer some of those questions. And Miriam, hello from New York. Nice to see you. Thank you for tuning in. Lisa is here for the first time. My soon Shaya, nice to see you. Thank you for tuning in. Edward's here for the first time as well. It's great to see you. Thank you for tuning in. And Adrian's here for the first time. Thank you for tuning in. This is something that we do every Tuesday at this time slot. So thank you for tuning in, everyone. It's so great to see you. This is the Dr. Janine Show. Okay, are we ready? Well, let's talk about the best foods for kidney detox. So does everybody know where your kidneys are? Your kidneys are located, and of course most people have two, in the back region. Really important that, and here we can see a great depiction of our kidneys. This is something that we definitely want to make sure that we're taking care of our kidney health. So let's go through some of the best foods for kidney detox. Number 1, watermelon. Watermelon is fantastic. Why? Because it contains lycopene, which is an important, of course, antioxidant, really protective. That's what makes it red, much like tomatoes have lycopene, so does watermelon. And eat the part that's close to the rind, so that white part is amazing. Really high in those antioxidants. Okay, another food I love for kidneys is lemons. Lemons are also fantastic, great, of course, and adding some freshly squeezed lemon into your water when you're drinking, a great way to deal with kidney stones, even for their prevention, so that's really important. Okay, number 3, dandelion leaf is amazing as a kidney cleanser and a detox, and this is a natural diuretic, so that's really important. And number 4, parsley and all your leafy greens. And guess what we're making today in the kitchen? We're making a fantastic recipe, which is my salad, which you're gonna love. Okay, so that is great for your kidney detox as well. Parsley also a diuretic, so it works like a little water pill, so it helps to flush through those kidneys and helps us that kidney detox. And of course, turmeric. So turmeric, great anti-inflammatory. Fantastic kidney cleanser as well, loaded with antioxidants. Whenever you're giving your body antioxidants, that's why healthy diet is so important with antioxidants, helping to quench those free radicals, but fantastic for keeping your internal organs healthy and working properly. So that's really important as well. Awesome. Thank you so much. Okay, if you want to screenshot this really quickly, some of the best foods so that you've got it for your kidneys. Awesome job. Okay, we are talking quiz time, woohoo! Is everybody ready for quiz time? Okay, so every week we play for a different prize. This week we're playing for the VitaTree Vita Detox. This is a full body detox, and this is from our fantastic sponsors at VitaTree. We thank them for making this show possible in the first place. And here we go. Are we ready? question number 1. You've got 30 seconds. Once you've got that question, you see it, you got 30 seconds on the clock. Just put your answers in the comments. Do your best. If it's your first crack at it, it's all right. Just do your best. You've got a couple more opportunities for quiz questions. Okay, is everybody ready? Here we go. I hope everybody's having fun. All right, here we go. Quiz question number 1. Are we ready? Name a symptom of low thyroid. You've got 30 seconds on the clock starting now. Let's go. Put it, and you can put it in more than one. All right. All right, you guys are fast. Wow. Hello, hello, HMM from, is it Leicester? Is that how you say it in the UK? Nice to have you here. Thank you for tuning in. All right, I see lots of people are putting in, yes, your answers. I'm liking this. This is so good. And 1 second. Okay, I hope you got your answers in. Yes, so let's go through some of those symptoms, of course, of low thyroid. So fatigue, loss of energy, yes, of course. Well, all those things that we saw in that chart. Eyebrow hair, so I don't know, did I mention this? With the outer third of your eyebrow hair, if that's thinning, then that can be a low thyroid as well. Hair loss in general, feeling cold, weight gain, constipation, depression, and of course, dry skin. So those are all common symptoms of having that low thyroid. Okay, great job, everyone. All right, give yourselves a round of applause. If you're here for the first time, please put a 1 in the comments. And thank you, yes, for sharing today's live as well. We have a lot more fun, a lot more quiz questions coming up in just a second. Okay. Now, I want to congratulate last week's winner of the VitaTree Immune Support. It was Felicia D. So congratulations, Felicia. Woohoo! You were last week's winner. Please make sure that you are following Team Dr. Janine. You're following my accounts as well. No matter what platform you are watching today, make sure that you're following Team Dr. Janine, though, if you're on certain platforms, so that we can reach you and send you your prize. So great to have you all here. Okay, now let's talk about our urination. Sorry to switch gears a little bit on you here. Let's talk about having a healthy urination. This is something that I posted on most of the platforms now, and it's something that's really interesting and garners a lot of questions when people start to learn a little bit about what's happening with their urination. Now, we will be going to the kitchen in just a few moments, and I'm going to show you my fabulous hack for making salads. Love it, love it, love it, and I'm going to show you that. Okay, so what should your pee look like? Well, if it looks like lemonade, that would be like a very light yellow color. If you can see that against my shirt, that light yellow color is an indication of a healthy urine, okay? Now, if it looks like water and it's very pale, then that could mean actually overhydration, that you may be drinking a little bit more than what you need. So not terrible, but just it's information for your body, okay? If it looks like honey, so if it's looking quite dark, that would be dehydration. You are not getting enough fluids in your daily life. Maybe you perspire a lot, you're outside in the heat, you're not hydrating sufficiently enough, either with water or with watery foods, fruits and vegetables. That's important that your pee does not look like this, okay? And even worse, severe dehydration, if your urine looks very dark like maple syrup, there is probably a kidney problem happening. Of course, you're seeing your practitioner and discussing that, but that's severe dehydration. So I don't know if you looked at your pee this morning or this afternoon or wherever you are in the world right now, but just take a look once in a while and make sure that it is a healthy, light colored yellow. Then you can gauge your, your hydration and how much you're actually drinking, water preferably, and a good quality water. Then that is something that you can gauge your pee to look like. Okay, so I hope everybody is learning something here. Yes, I like to talk about all the topics that nobody likes to talk about, pee, poo. If you've seen my previous videos and my poo platter, then you know that I have no problem talking about these things. Okay, we are at quiz question number 2. Is everybody having fun? All right. Nice to see you, Anaya. Thank you for tuning in today. And yes, okay, Sandra, you have good-looking pee. That's good. All right, awesome, awesome. Okay, we are at quiz number 2. Are we ready? You've got 30 seconds. Name a good food for kidney detox. Name a good food for kidney detox. You got 30 seconds. Go, start now. Let's go. All right, everybody get your, I'm talking foods. What's a good food for those kidneys for detoxification? Everybody get your answers in. about 15 seconds left. Just try your best. Even if you don't know, just guess something. Good foods for your kidneys. I see some answers there that I didn't talk about. Yes. Good job. And good job, everyone. I saw so many good answers. Okay, yes, a lot of people said watermelon, which I love to see because that was first on my list. Beetroots, oh my goodness, so many answers coming in. This is fantastic. Good job, everyone. This is amazing. A lot of people said watermelon, so that's good. Lemons, yes, absolutely. Leafy greens, we are going to the kitchen just a second with my recipe, so you're gonna love that for my salad. Good job, everyone. Okay, you've got one more opportunity for quiz questions if you're just tuning in now. Thank you for tuning in. If you're here for the first time, put a 1 in the comments. It's great to have you all here. And if you've been here a few times, put 100 in the comments because I know a lot of you have been watching now for a couple of years. The Dr. Janine Show, I know that you're here every single Tuesday and I recognize your names when I see you and love you all. Thank you for tuning in. Thank you for sharing today's live as well. It's so great to share this with your friends so everybody can join in on the fun. We do have one more quiz question coming up. All right, now let's talk about I want to thank our viewer spotlight. Yes, so every week we call out someone who has really shared some great feedback on my social media platforms, and it's so great to, have you all here. And I appreciate everybody who participates in any way with your positivity, which I absolutely love. Okay, so I want to call out Zoe Life 7272, who said, "Thanks, Dr. J. I recommend your advice to everyone I know. I learned so much from you. Changed my life." Thank you, Zoe. That is amazing. Oh, I just got goosebumps. Music to my ears. Thank you so much, and thank you for sharing your positive feedback. Honestly, I love the comments. I love to see all of that good energy. We need more of that in this world, and thank you for sharing all that great stuff, and continue to bring in and send in all your great feedback and comments. Awesome. Okay, we are talking PCOS, ladies, so I did have a lot of questions. Whenever I post anything about women's health hormones, a lot of questions come up about PCOS, which of course is polycystic ovaries, and this is something that even if you don't suffer with this, if you do as a woman have, menstrual cramps, menstrual issues, someone, your wife, it could be anyone. Your daughters could have this as well. This is really important. Now, we do have another quiz question coming up, so don't go anywhere. But let's go through some tips for PCOS really quickly. Isn't this a pretty slide? Oh, I love these colors. Whew, thank you. Thank you, Sam. That's Sam behind the scenes. All right, so number one, you want to, with PCOS, definitely limit your carbohydrates. So every time you're spiking your blood sugar levels, especially with the bad carbs, so those refined sugars, really bad for PCOS because there's definitely a correlation between having irregular blood sugar levels and the inflammation that happens and the leptin resistance. So this is really important with your insulin and your leptin signaling that you get this right and fix that leptin resistance, fix the insulin resistance, and this is a problem when you're having too many refined carbohydrates. So that's really important, okay? So number one, limit your carbs. You can screenshot this when I'm done, so we're gonna get done in a second. Number two, consider doing that full body detox. Yes, using herbal medicines to really take that toxic load off of the internal organs. Your liver has a lot to do with the making of your hormones and the detoxification of your hormones, as well as your bowels. So if you're not eliminating properly, then this is a problem. Your kidneys need to be working optimally as well. So that's why really addressing all of those internal organs is going to be important for helping with that PCOS. I helped a lot of women with this over the years, in my practice and seeing my patients. And number three, acupressure. So if you've got pain, and this goes for menstrual cramps, any type of lower abdominal pain, digestive pain, stomach pain, gut health pains, and PCOS pain, there is a specific acupuncture point which works amazing. It works instantly, which you will absolutely love. I'm going to show you where it is in just a moment, but it's called Spleen 6, and it's really great for that cramping, great for that PCOS pain. Okay, so let's go over here, and I'm going to now show you exactly where this point is, and we're going to take a look at where it is on the chart on the body, but it's basically you're going to use your palm and you're going to find your medial malleolus. If you don't, it's the middle bump on your ankle, okay? So you're going to find that point, and I want everybody to don't just watch me, just do this on your sit down if you can right now. As you're doing this, ladies, guys as well, because this is an important tip that you can really help anybody who has cramps or whatever, even the guys, okay? All right, so you've got that medial malleolus. You're going to put your pinky side of your hand on the middle of your medial malleolus. Okay, everybody got that? So the pinky, so it's your opposite. So this is my right leg, so I'm using my left hand. So opposite hand and leg. You're going to put that on the middle ankle bone. And now where your hand ends up, roughly that is the point where that spleen 6 is located. So that is the acupuncture point. What you're going to want to do is do little circular motions. And you're going to find that point because when you find an acupuncture point, you usually find that it's, whoo, ow, it hurts a little bit. And you're going to find that there's a little depression in that area. And so that's how typically, you know, as a practitioner, when I worked on my patients, that's how I would find the points is, yeah, we know the general location of it, but you got to find for that little depression. And now you're just going to do little circular motions in that spleen 6, which is amazing for your PCOS, okay? I hope everybody's doing this. Everybody's doing this? Yes, yes, yes. Awesome, awesome. Thank you so much for tuning in, everybody. So many lovely comments today. Thank you, guys. You guys are the best. Awesome, awesome, awesome. And I know other questions are coming in. I'm going to be able to show you, if you do have specific questions throughout the show, which I should have mentioned earlier, that I want you to be able to tune into, that you can actually send an email to the team and they can actually specifically answer a lot of your questions. But I'll be showing that in a few moments when we get to the Q&A section, because you'll have a chance to ask me some questions. I know I'm talking a lot. Okay, how are we doing? We're good. Okay, we're going to the kitchen. Woohoo! It's salad time. All right. So not everybody gets as excited about salads as what I do, but this is one of those things that I absolutely love. And making a healthy salad is a great way that you will be able to not only stay on track, especially for right now in Canada in summertime, we have an abundance of fresh fruits and vegetables, much of which came from the farm actually. So yes, this is delicious. So I always prefer organic whenever you can. If you can grow it yourself, definitely better. But this is my salad jar recipe hack that you're gonna love. All you need is a mason jar or any type of jar that you can actually close, because this is something that you're going to keep in the fridge, and you can prepare this a few days ahead of time. And it's a great way now to bring your salads to work or to wherever you go, to school, whatever, throughout the day, but super, super easy. Okay, so all we're doing now is putting our dressing in the bottom. So I like to use extra virgin olive oil, and of course I'm putting that into the bottom of my jar. And I'm quite liberal with olive oil. It is summertime, so it's a great time that you're able to actually, you know, utilize this for your metabolism. So I love my olive oil, okay? A little bit of apple cider vinegar. You could also go with, of course, this is balsamic. And so mixing that in, a little bit of salt and pepper to your taste. You can use whatever spices that you like, and totally up to you. I like a little bit of salt, can you tell, in my salad. It just brings out all the flavors for me for all the vegetables. And you don't have to be shy with salt. Salt consumption is actually good. It helps to balance your electrolytes, especially when you perspire a lot. I perspire a lot. You know, I do a lot of things outdoors. I'm in the sun a lot. So getting that extra salt is really important, especially for me in the summertime. Okay, so you can switch that around a little bit, and you could do more or less of your dressing. It's all up to you. All right, now what we're adding in, and you will be able to screenshot this recipe. You don't have to remember any of this. In just a second, we're going to show it up on the screen in a second. So I've got a bit of onion. You don't have to use onion, but I like the onion to sort of sit in the bottom, because that, well, let's just use it all, because that will marinate in the sauce. Because remember, you're keeping this sauce and the entire jar in the fridge up to a few days, which is great. Some sliced cucumbers, okay, so that's going in as well, and I like that to marinate in the dressing. I also have a bit of feta cheese, so that combination, if you're dairy-free, you don't have to use feta, it's totally up to you. I have some chopped carrots as well, so yummy, yummy, yummy. And you can see the beautiful colors that are happening here. And again, whenever you can do organic, that's definitely better. Red peppers into my jar as well. And here we go, making a mess, as I always do, but that's all good. There we go, there we go. There's nothing like live television. When I'm on TV, the pressure is on as well when I'm on live television and I have to mix things up. Okay, I did some roasted garlic, organic garlic, fresh out of the ground. Our friend has a farm. She brings me fresh stuff. Love it, love it, love it. So yeah, roasted garlic that we actually did on the barbecue. So I'm just gonna put it, I'm gonna put all 4 in. Let's be really great on the antiviral and of course the immune components and the blood thinning effects of that garlic. Love it. And then all you're going to do then is basically stuff your lettuce on top. So this is, again, organic greens that I've got, as many as you can stuff in here. And I stuff it a lot. And so when I actually turn this over, it takes a little bit to get it out of the jar. But here we go, stuffing, stuffing, stuffing as much as you can. Oh, so good, so good. And just the flavor of these fresh greens. Of course, and I've already washed my greens and I put them through the salad spinner to get the extra moisture out, because you don't want it to be too moist, because you want this to last for a few days for you. And stuffing in as much as you can. There we go. And that's it. So yummy, yummy. All right. Then you just seal it with your lid, and then that goes in the fridge. And then you could keep this in the fridge. Now you'll see that of course, does anybody do these salad jars? I'm so curious. Yeah, awesome, awesome, awesome. And yes, you could use spinach, absolutely. This one isn't spinach, but you could use spinach, you could use kale, whatever greens that you love, because remember, we talked about kidney detox a little bit earlier. Those greens, the leafy greens, great for kidney detox, but great for your liver as well. If you do some of the more bitter ones, then that is fantastic as well. And then basically, all you do, and you'll notice I don't have my protein in here yet. So then when you're ready for it, whether you're at work or wherever, you're just gonna toss that like this. So you just let that all incorporate. And some people like to shake the jar. I don't. Some days I do, some days I don't, but then you're just basically going to let that all come out of your jar, and then you can see, because I've stuffed it so much, that it takes a little bit, but now all of that dressing is becoming incorporated onto the plate and into the lettuce, and you have the most beautiful salad. Now you can then top this with whatever you like, okay? So everybody gets the idea. Here we go. Once you get it going, then there we go. Yummy, yummy, yummy. Ooh, yes, there. And isn't that the most delicious thing? It's not lunchtime yet, but I really want to be eating this right now. And then you can top it with whatever protein you like. So this is some coconut shrimp, my fave. And then, whoops, we put that on top. You could do chicken, you could do whatever protein. If you want to do more cheese, if you're dairy-free, then do whatever you like. Put that on top, and you've got the most delicious salad. Okay, so I hope you're loving this. Yes, you love that, and love it, love it, love it. Yes, I know, Thai baby, you love the salads. Okay, so I want you to screenshot this really quickly so that you've got it. So in your mason jar, that's the key, is put your dressing at the bottom. You can do that, and of course, whatever spices you want to add in there, you can do that, of course, and you don't have to do the feta cheese. I mean, these are all optional ingredients. Whatever you've got in your kitchen, just slice it up, put it in your jar. Amazing, amazing. Okay, did everybody get that? You screenshotted it? Aha, yes. I'm so glad. I'm so glad you're loving this. Thank you, thank you, thank you. Okay, we are at quiz question number 3 already. Okay, so if you're new here, you're here for the first time. Nice to see you. Thank you for tuning in. Thank you for sharing today's live as well. Okay, so we are going to be on quiz question number 3, and this is what you're playing for. So if you're just tuning in, every week we have a few quiz questions. This week we had 3. This week we're playing for a free bottle of the Vita Detox. This is a full body detox from our great sponsors at VitaTree. We thank them for making this show possible. So this is what you're playing for. Everybody do your best. Everybody ready? Okay. This one's a bit trickier. Here we go. You're gonna have 30 seconds. What is the name of the acupuncture point on the lower leg that can help with PCOS and menstrual pain? You got 30 seconds on the clock. Let's go. Oh my goodness. Wow. All right, let's go. 30 seconds. Here we go. Everybody get your answers in. Wow. I have a lot of people that are paying attention. Very good students. Very, very good students. Yes, somebody was saying to add egg. I should have mentioned with my salad recipe that we just made, you could definitely put an egg on there as well. Amazing, amazing. Okay, 5 seconds left. Get your answers in. Most of you got it right. I am impressed. I thought I was going to trick everybody. Okay, so the answer is, of course, spleen 6. Congratulations. I am super impressed for all of those great answers that came in. Good job, everyone. Okay, so I do want to shout out really quickly our super fans. So there's something called super fans, and thank you. There's actually donations being made to the Dr. Janine Show. So I thank you so much. Continue to share all your positive feedback, and thank you for those donations. Amazing, amazing. So this is Then Kate's Row 8539. Say that 5 times fast, and I know I didn't say it properly, but thank you so much for all of your support. That is amazing. Thank you, thank you, thank you. I truly appreciate it, and thank you for supporting the show, that we can actually bring you a show every single week. Thank you, thank you. Okay, so if you're just tuning in right now, we've talked about a lot of things today. We've talked about healthy pee and what your pee should look like, talking about urination. We talked about kidney detox, some of the best foods to detoxify your kidneys. We also talked about PCOS tips, and I shared that spleen 6, which so many of you answered correctly in terms of the quiz question, that acupuncture point that really helps with the PCOS and pain and menstrual pain, which is amazing. And we talked about low thyroid, some of the symptoms, but more importantly, what to do about low thyroid, fixing that leptin resistance. And if you're new to my channel, make sure you check out all my posts and my videos and my information on leptin resistance. Okay, so I wanted to show you as well, if you missed the salad recipe, so the deliciousness of my salad hack, putting it in the jars, amazing, amazing. So this one is topped with some coconut shrimp, which I love. This is going to be my lunch, and I'm very excited. So I hope that you love that recipe. If you wanted to see, or for us to screenshot any of what we saw today, please let us know, and we'll put it up on the screen so that you can screenshot it. Oh, I think, yeah, the salad jar recipe is up there, so that's super easy. Awesome, awesome. You got it right there. You can screenshot that really quickly. You want to see the thyroid, Coral Blue Waves thyroid chart. Okay, let's go over here and look at, again, I think we can look at the thyroid. So the symptoms of low thyroid. And do I have a few minutes? Yeah, I can go through this really quickly. So symptoms of low thyroid, whether you've been diagnosed yet or not, these are also very commonly symptoms found with leptin resistance. So that's why fixing that leptin resistance is really important. Okay, so low energy, fatigue, depression, swollen face. You could have swelling of the eye sockets, not always, with low thyroid, weight gain, slow bowels, so that's really important, that constipation. Rough, dry skin is very commonly found. There could be muscle cramping as well with low thyroid, as well as hair loss, and especially the outer third of the eyebrow hair. If that's gone, then that can be a low thyroid as well. Slowed heart rate, enlarged thyroid gland, but not always. So your thyroid could be of normal, shape and size, but you could still have a low thyroid. And there's something called subclinical hypothyroidism. I don't know if you want to screenshot that really quickly. There's a few symptoms that I usually like to add here too, like feeling cold all the time would be another one. So your body temperature, you feel cold, would be another common thing with low thyroid, and night sweats as well. So as much as, yes, you're cold perhaps during the day, at night, when your thyroid is more active, then it could be overshooting and it can't control the proper temperature, and you can have those night sweats. Okay, you want to see the supplements chart for the thyroid? Okay, let's look at that really quickly as well. We'll come over here. Great feedback, guys. Thank you. Okay, good, Shelly. I'm glad that you learned something. All right, awesome, awesome. Thanks for sharing today's live as well, guys. I know a lot of you shared, so thank you, thank you, thank you. Sharing with your friends, and continue to, comment on all of my posts, which is amazing. And it's, yeah, I think I'm creeping up to almost 2 million followers now, like on the different platforms combined. So it's amazing. What a fun, way to educate people. It's funny because my son, the youngest one, said, Mommy, like when he was in school, of course, school is out for summertime right now. It's like, Mom, I don't want to go to school. I'm like, why? It's, well, you get to go to work and all I get to do is make TikToks all day. So it's fun. I have a fun job and I love educating all of you, which is fun. And he does have a point. I do get to have a lot of fun. But I said I wouldn't be able to make the TikToks and educate people if I didn't go to school. So I had a good answer for him, which is true. Okay, how do we support that thyroid? Of course, iodine, important nutrients, magnesium, potassium, calcium, boron. For scholi, tyrosine, ashwagandha. So these are some of the minerals that I actually personally take in a thyroid supporting supplement. That's something I take 2 capsules every night at bedtime, and that's something that really, really helps me and my low thyroid function and to keep everything functioning optimally, which is awesome. So yes, Granny, great question. So still supporting the thyroid with what it needs is important, and especially, and I hear this all the time, and for myself, I can't tell other people what to do, but for myself, even though, practitioners said, oh, your thyroid's fine, your blood work's fine, for myself, I still took it upon myself to make sure that I was supporting my thyroid gland to make myself feel better, because it's one thing for your blood work to be fine, it's another thing for you to actually feel good. And if you're not feeling good and you keep doing the same thing over and over again without a different result, what's that the definition of? Insanity, right? So you've got to advocate for yourself and for your own body and do your best to feel better. Okay, so I hope, yes, if you do want to view this again, of course it does live on Instagram, so you'll be able to view it again if you missed any parts of today's show, and on YouTube as well, so you can definitely refer back to it and watch it all over again. And look at my previous episodes as well. Every week I have a different show topic that I talk about. Okay. Nanda has a great question. Can low iron cause weakness when you wake up in the morning? Absolutely. And guess what you also need for your thyroid and your energy levels is good amounts of iron. So that's really important as well. And if you're just tuning in, yes, and if you do have questions, I want to pop that up really quickly as well. If you do have specific questions that I wasn't able to answer in today's live, please send an email to the team, hello@vitatree.com. They're very well versed in all of my protocols from my books and what I've talked about and educated people about for years. And yeah, so please make sure that if you do have specific questions that I'm not able to answer, please send a question, always in our commenting feeds as well. On all of our social media, you can definitely ask your questions there. Hello in Samia in Preston, UK. Nice to see you. I'm just going to grab my water real quick. Thank you. Oh, the leptin talk. Mimizi. Yes, the leptin talk. Can we just pull that up? I got like 2 seconds. Let's go. 2 seconds, leptin. Okay, leptin is something that's secreted by your fat cells. And when your leptin signaling is off, when you have leptin resistance and your brain is not reading the proper signals, and then you can crave a lot of carbohydrates. It causes a lot of inflammation in your body. Now you've got problems potentially with your insulin. Then you're secreting more leptin because you're gaining weight. Some people will lose a lot of weight as well with leptin resistance. So things like Graves' disease and hyperthyroid, also related to leptin resistance. So either you're overweight or you're underweight with the leptin signaling problem. So that's something that you have to realize, that it's not always about the weight gain. That's the problem. It can go the other way as well. But now you are not in a healthy mode in terms of your hormones, and you've got more inflammation happening in the body, and that leptin resistance is going to cause other problems as well as, autoimmunity and other problems happening. So yes, it's important to be able to find that balance with the leptin and the leptin signaling. That's why I share so many different posts about leptin resistance and my tips and what you can do about it. So please make sure that you check it out. Thank you for all the compliments coming in. I see that. Navina's 44, morning sunlight on the thyroid, effective for kids too. Absolutely, get those kids outside in the sun, especially that morning light as the sun is rising. I know it's difficult to get kids up at sunrise, but as close to sunrise as possible. Get them up out. For my kids on the way to school in the morning, yep, look at the sun, look at the sun, look at the sun. You gotta look at the sun. Even if it's just for a few moments, look at that sun, get it on face, neck, thyroid, very important. If you drive to work, open your car window. If you drive your bike to work, even better, you walk to work, no sunscreen, no makeup, especially on the thyroid. That's really important. Actually, let's do a post on that. See, I think on the fly here, I'm going to do a post on not putting makeup on your neck. That's a good one, because most makeup now has sunscreen, and you're going to block those healing rays of course, those sun rays on your thyroid. That's a good point. I just made a post right now on the fly, but watch for that coming up. I hope that you're following me, of course, as well. And I need to go eat my salad. Yes, if you missed it, then of course we made a delicious salad today as well. Okay, so thank you. Our next show, so next week we're talking about safe sun tanning tips, which is amazing. I'm going to be sharing some great knee exercises. We're going to talk about osteoarthritis of the knee. We'll probably come back to leptin resistance as well, and I might throw in a recipe and a beauty recipe in there as well next week. So I hope that you're going to tune in. I hope that you enjoyed today's live, and I always endeavor to teach you about the healing of your own body, mind, and spirit, and of course doing it naturally. It was so great to have you all here today. Actually, next week maybe we'll play for one of the Doctor Janine mugs with the quiz section of the show. Maybe we'll do that. So make sure you tune in next week. It was so great to have you all here today. Thanks for tuning in. Have a great and healthy week, and we'll see you next time. Get lots of sunshine. All right, bye-bye.